Welcome to the Melinda Eitzen Show. I'm Melinda. Today, we are so fortunate to have with us Dr. Jennifer Fast and Dr. Paul Stanford from Stanford Couples Counseling. Welcome.
Thank you.
Thank you. Nice to be here.
It's so good to have you both here. So, even though it's called Stanford Couples Counseling, you do more than couples counseling, true?
True. That is accurate. We do individual, couple, family therapy. We even have groups. And then through Dr. Fast, we do quite a bit of psychological testing as well. I don't know if you want to go into that at all as far as what psychological testing.
Yeah, we'll get to that. We'll get to that.
I'm not curious about
So tell me, how many counselors and how many locations?
20 counselors and 7 locations.
Oh, so all over the Dallas-Fort Worth area.
Correct. Yep.
Well, that is convenient. So no matter where they are. And does you offer online as well, like
Yep.
Zoom?
So we can see anybody in the state of Texas because we're all licensed in Texas. And then we have several providers. Dr. Fast is one of those that is licensed in other states as well.
Oh, that's good. Okay, well, let's start with the couples. I'm a divorce lawyer, as you know. And one thing that happens is people go to counseling first before they come to the conclusion that they need to divorce. And sometimes only one person wants to go to counseling. But if somebody is sitting there thinking, how do I know if it's time to make the decision to divorce or if I should try one more time? How does somebody reach that conclusion?
Super easy. Dr. Jennifer has the answer to that. So.
Put me on the spot. I think a lot of different factors go into that. And when a couple is making a decision about whether it's time to part ways or if it's worth it to give it one more go. And I think it's one of those factors I really think is motivation and like where both partners are in terms of how much respect they still have for one another, how much love they still have for one another. Do they still have shared dreams and goals for their lives together? Sometimes you'll have a couple where one partner is kind of already wrapped their mind around separation and divorce, and we call that leaning out, and they might be leaning way out. And so trying to bring them back in can be really, really difficult. And then you'll have the other partner who's still leaning in and wants to work on the relationship. And I think those are the hardest ones. If you have a couple coming in where they're contemplating separation and divorce, but they still can talk about some things that they share and love that they still have and respect, then there's some hope there to save that marriage. Mm-hmm. But the ones where there's one leaning out, it's very clear that they are, and one's leaning in, those are the hardest to work with.
Do you all offer discernment counseling?
We do.
Explain to the audience what that is.
Go for it, Dr. Stanford.
So just what Dr. Fast was just talking about, a lot of times in relationships and marriages, you'll reach a point where one person is what we call leaning in. They're still invested. They're still willing to work on the relationship. They want to make it work. And you'll have a partner who's leaning out where they might not be ready to call you quite yet, but they're closer to that than they are to trying. And so they're not really sure whether they want to try or not. So it's called a mixed agenda couple. So what used to happen is couples therapists would either tell them, sorry, I'm a couples therapist, so I can only work on a relationship if both people are willing to work on it. So if you decide you're willing to work on it at some point, come on back, which is, in my opinion, terrible because then they got nothing out of that. They got no assistance. Or they would do some halfway version of trying to do couples therapy with one person kind of checked out, which I tell my couples all the time. I've literally never seen a relationship get better where only one person was working at it. So you can imagine how often that works. So Dr. Bill Doherty that came up with this concept of discernment counseling of it's more of an information gathering process. So it's not about, it's a short, brief 3 to 7 session commitment, and you're going through deciding why is it you're leaning in and what should you be doing to support the leaning out partner, because usually the leaning in person is either pulling them, come on, we can do this, or pushing, fine, if you don't want to talk to me, I don't want to talk to you. And neither is particularly helpful. And then for the leaning out partner, why are you leaning out? What are the things that would cause you to lean in? What are the things that would cause you to decide like it's too far? So it's really to make a choice of, are we going to split, or are we going to at least commit to working on it for a committed amount of time and agree to what we're going to commit to do during that time, and then check again in 6 months and see, are we willing to keep going? Or it creates evaluation points rather than just flying blind.
And if they do decide through discernment counseling, let's keep working on it, then they go into more traditional couples counseling.
Correct. But only once both people were on the same
On the
page.
board.
Yeah.
Sometimes do they need to, in addition to couples counseling, do individual counseling?
Yes, for sure. I think most of us in the practice recommend that pretty regularly, because that relationship issues and problems and contemplating divorce brings up a lot of stress and distress. And sometimes, the partners need a separate space to really kind of process what they're doing, kind of where they're at in their life, where they're at in their relationship. Sometimes there's already mental health issues, pre-existing mental health issues. And so needing a space for that, because that process can really bring up a lot more anxiety or depression or just feeling helpless and hopeless to change the situation.
I would say the more mixed agenda they are, the more individual is probably going to be needed. There are some couples therapists that are purists that will only see them as a couple. But what I have found is a lot of times, if there is one that's leaning out or there's one that maybe has more significant mental health challenges, it can often be helpful to split them up and be able to talk one-on-one without the other person there, where you can actually challenge them and push them a little bit, where they're going to respond differently when they don't have their partner staring at them, ready,
Without an audience.
right? Well, ready to dissect that answer or use it as a weapon potentially later in fights or arguments or whatever it might be, where they can just be honest about where they're at and where the struggles are, and we can actually process those, rather than they're going to often, if in the couples dynamic, if they haven't talked about this thing for 15 years, they're not about to start now. So, but if the partner is out of the picture in the session and you can just say, hey, what's going on here? Like, I definitely feel some hesitation here. Then a lot of times you'll get very different answers that then you can infuse back into the couples therapy once you've prepared them for how to do that well.
Oh, that's good. What are the top reasons for divorce that you see?
Infidelity, money problems, I would say, are really the top two that come to my mind of why people get divorced. Those can be very difficult to get past.
Infidelity is actually the cause of the breakup of the marriage, or they already had an underlying problem that caused somebody to be susceptible to infidelity? That's my theory.
That's a complicated question. I think it depends, because that's what therapists say. It depends. A couple of things come to mind. I think one is when you're choosing your partner. If you're ignoring those red flags from the very beginning, sometimes we see couples who are on the brink of divorce. There's been infidelity where if you go take them way back, you ask them their dating story, you can hear some of those red flags or even those yellow flags that they just blew past because they were in love.
And they were cheating on them before they even got married.
Right.
Oh, I had one person tell me, before we got married, at 2 a.m., we're in the drive-thru at Taco Bell, and he pushed me out of the car and drove away.
Yes.
The words, before we got married, I was just shocked.
Yeah.
And you got married to a person who pushes you out of the car at 2 a.m.?
Yes.
And of course, guess what? He threw her across the room when she's pregnant, and now we're getting divorced.
Yeah.
Yeah, red flags.
When it's not always that overt, right? A lot of times it can be subtle. Like if you're dating someone and 3 weeks in, you're already finding out, and you're exclusive, you decide to be exclusive, and you're already finding that they're texting with exes or hanging out with girls or men or women that they're hiding from you.
People are sliding into their DMs.
In a month in? Like,
That's
is that an affair? No, but how trustworthy is that person? But people, because of this thing called limerence and because of love, and people get all excited and love struck, they go like, oh, well, but this can change. This was a kind of a lingering, because that person is going to make some excuse. They're going to justify it, and they lean into the justification because they don't want to be alone, or they think this person has potential, which, again, not every relationship, beginning, middle, or long term, has flags, right? It's got it's got flags to green, yellow, red, but you got to determine, like, what are your red flags and stick to those, because otherwise you find yourself in a world of hurt 10 years later with 4 kids, you know?
Yes.
Yes,
Better to pay attention at the beginning.
Yeah, I think people tolerate a lot more at the start of a relationship than maybe they should, for a variety of reasons. There's so many different reasons for that. And then I think there are the cases of infidelity that arise because of sort of the progression of the relationship, of the marriage, where the couple stops connecting, they stop communicating, they stop prioritizing the relationship. So their emotional needs are not being met, their physical needs are not being met, and they look elsewhere. It's not an excuse. I think we would, we agree that in therapy, we're not saying, oh, that's a great excuse for why you did. Like, sure. But more of like, it's context, right? It's a reason, it's context. And when we're talking about like, Gottman is a very popular marriage counseling model, and they talk about the sound house. And so I always talk about this with couples where there's infidelity or other issues of like someone left the door open, someone left a window open that allowed for the opportunity to look elsewhere, to form relationships outside of the marriage house, the relationship house.
I tell people, wait to have the affair until after your divorce.
Smoking like a family law attorney. But to your question, there actually is fascinating research. I think it's fascinating research recently that there's kind of this prevailing theory in the therapy world, and I think in general, that if somebody cheats, if there is an affair, there's something broken in the primary relationship that has contributed to that. But there's a lot of research coming out that shows that that is not the case a pretty good percentage of the time, where we live in a day and age where opportunities abound, and sometimes people just make selfish decisions, and it doesn't necessarily indicate that they have an issue or a void in their primary relationship.
Oh, that's going to be hard in our cases, because what's hard about cases where there has been adultery that has caused the divorce is it's very easy for the person who was betrayed to feel like this is 100% your fault and 0% my fault. And you're saying that might be true.
Well, so it
makes it hard to settle the case. They're like,
it's a mix, right?
I'm an angel.
Because like Jennifer said, they're still responsible for their behavior no matter what. But I also said a few minutes ago, right, that I've never seen a relationship get better. Now that relationship isn't getting better, but you should always be, even if you're not the one who cheated, you should always be thinking, what could I have done differently in this relationship to make it a healthy relationship? Because I've never met a person who said, well, in their right mind, I was just a perfect partner. There's literally nothing I could have done differently in my relationship, right? So focus on that, not for the purpose of blaming yourself, but for the purpose of improving yourself moving forward, even if it's not with that person. Because something got that relationship to an unhealthy point.
So let's say we're at a point of divorce. People are getting a divorce every day at my office. I think everyone going through a divorce should be in individual counseling, because it's a major life change. Do you agree that it would be helpful?
100%.
And it doesn't mean they're crazy. I mean, sometimes they are also, but just to have help with the transition of what's happening in their life. It would also help me to deal with them if they were an individual.
That's what we're here for.
Yes, I know.
Yeah.
Like, can't you just talk to Paul about that? No. Because we're counselors at law, but without the psychological background and training. On the job training is what I have done. So I am a good listener, but I think it's helpful to them to have individual counseling. There's also times, Dr. Fest, where you come in and do a psychological evaluation because it's court ordered. So talk a little bit about that.
Yeah. The cases where I've been called in to do a psychological evaluation is, unfortunately, there's a lot of he said, she said kinds of situations. A husband is accusing a wife of significant mental health issues. They're accusing each other of poor parenting. They're accusing each other of personality disorders. That's a big one right now, is you have narcissistic personality disorder. You have borderline personality disorder.
Everyone wants to say everyone's a narcissist.
Yes.
I hear that word so much more now.
We hear it all the time. We used to hear everybody.
Oh, I'm sure you hear it in every meeting.
But now they're all narcissists.
They're all narcissists, yes. So in order to try to clarify some of that, I think, and to make sure that the people involved are, in fact, psychologically stable. My experience has been, you would know this better than me, my experience has been that a judge will ask both partners to just go through the evaluation process instead of one, and just to like equalize it and make sure not one is being singled out over the other. And so then my job is really to dig in, to get the history, assess their psychological functioning in terms of past psychological functioning, current psychological functioning. If there's a diagnosis to be made, I make that diagnosis, I make recommendations, and then that report gets submitted to the lawyers for review and to the court for review. And hopefully, the individuals are following through on those recommendations.
We're all could have some traits of a narcissist, right?
Mhm.
There's a list of however many in the DM. What number are we on?
DSM
5TR with a revision coming in the next couple of years.
So let's say there's 7 things on the list that make you a narcissist. We all have a few of them, right?
Yes.
And that's why I think people think everybody else is a narcissist. They're like, oh, that's on the list. You have one of the traits. But it's normal to have a few of them.
Absolutely. There's when you look at personality disorders, there is 3 categories. There is a style, personality style. There's traits. So like what you're talking about, we all have traits of certain types of personalities. Most of us have traits of narcissism. Some people can't really be successful. They can't, I'm thinking of like musicians and artists and actors and, to like go in front of large audiences and perform. They have to have a little bit more of an ego, a little bit more narcissism there in order to do that. And then there's a full-on disorder. And so having traits is not a problem. Having a few more than just a couple of traits, you get to a style, and that might create some dysfunction, some challenges. But a full-on disorder is disrupting their life. It's disrupting their relationships. It's disrupting the way in which they move around in the world. And so that's a way to understand that we all have a little bit, but not all of us have a disorder.
Sometimes people are hesitant to admit or get treatment for a mental health problem in a divorce because they think it'll be held against them by the court. And the opposite is true. Judges embrace people who embrace their mental health problems and are getting treatment. Maybe they need treatment and medication. Judges say thumbs up to that because people can be treated and function well if they're getting treated, and if they need medication, they're taking it. What judges don't like is when somebody has a problem and they're pretending they don't and they're doing nothing about it, especially when children are involved. We don't care as much if there's no children, right? You're getting divorced. Just go be crazy.
Live your life.
Right. We don't care. But when children are involved and they're talking about who should have what parenting schedule, that's when this all comes up, right? And when people really care. But if somebody did have a disorder, there's things to do about it, right?
Yes.
Right, and judges have seen enough to where they're not mental health professionals, but they've seen enough
Are
mental
very
health issues.
educated.
So then they're going, oh, this person has these issues. What are they doing about them? Oh, nothing. Not only nothing, but they're claiming that they have no issues. Red flag.
Yes.
Right.
And they have a psychological evaluation that says,
yes.
and they're ignoring that as well.
Yes.
Yeah.
Not good.
Yeah.
Not a good look, as they say.
But that makes me think back to your question about when to divorce or when to keep trying. And the research does show, talking about kids,
Yes.
that generally speaking, it's better for the kids to be in a 2-parent home as long as it's not volatile. And obviously if there's not abuse, neglect, and things like that going on. So I think a lot of people do throw in the towel too early in the name of, well, it can be good for the kids, but it depends on the dynamics of the relationship as well. And that's often where a couples or family therapist can help you work through those things, even if it's on an individual basis. We see, like we said, a ton of individuals, a lot of times for relationship issues, where they're just coming in going, I don't know that I'm ready to work on this or if it makes sense, but I want to have someone help me evaluate what am I doing in the situation. And especially, we're in the Bible Belt here, so I'm a Christian, and having been through a divorce myself, there's a lot of things to consider there that a lot of times are contextual. You talked about people needing to go through counseling, going through divorce, which I think is true in general, because I think to a person, myself included, you can't help but feel like a failure because the relationship literally failed to survive, and you stood up in front of hundreds of people probably, and people call you by this name if you're a woman typically, and that sort of thing, and then all of a sudden all that goes away, and there's lots of shame involved. And most people do not get counseling, and then they just carry that on with them without ever actually having somebody walk through that with them and help them get feeling.
I've definitely had cases where for religious reasons, they have stayed married in a very unhealthy setting for longer than they should have, because their religion was not supportive of divorce, or in their minds it wasn't, even though
Yeah.
the situation was bad. And it's hard to know, is it something that could be improved or not?
Yeah.
None of us are saying stay in a relationship where you're getting beaten up, right? That's unacceptable.
Even the church doesn't say that.
Yeah.
Right.
Yeah.
And even that's why I say sometimes somebody has skewed what their religion says in their own mind. Or the other person is abusing them, not only physically, but mentally, and saying, if you ever leave me, I will take their children. If you ever leave me, and all these untruths, which nobody gets to just take the children. That doesn't work, especially the beater.
But that's why, to me, it's a red flag. If you're saying to your partner, I'm willing to go to couples counseling, which is a vulnerable thing to say and be willing to do, and your partner says, no thanks.
They should never say no thanks.
Yeah.
I have cases where someone comes to me and they're shocked that their spouse has filed for divorce. And then they tell me 2 years ago, she or he asked me to go to counseling and I didn't think we needed it. So I refused. Yeah. I'm like,
here's your sign.
Well, it's too late now. It's usually, hopefully not, but it usually is because that person mourned the marriage while they're in it. Mm-hmm. And if that is the biggest wave, if someone says, we need to go to counseling, you need to pay attention to that.
Mm-hmm. Absolutely.
Okay, let's talk about substance abuse. Okay. I have seen the worst substance abuse cases in the last year than maybe my whole 31-year career. And I'm hearing statistically that younger people are not drinking as much. Maybe it's because they're doing something else, dosing or something, but I'm hearing that they're not drinking as much. But it seems like these older people, the boomers, are drinking way too much. And used to, I felt like they would not do it, at least when they had responsibility for their children or in front of their children or have as dramatic things happen in front of their children. But I've had some really horrible things right in front of the children, traumatizing the whole family. What are you seeing in your practice?
We just talked about this yesterday. It's definitely an epidemic that I experience constantly, even in my individual work. It's not just in couples work, where I've seen more and more in recent years, people not only using substances in front of the kids, but doing it while driving or driving while intoxicated with kids in the car, which has always been a thing. Of course, people make poor choices, but I don't know about you, but I feel like that is much more to where I have clients going through divorce proceedings and having to put that in there because they know that their spouse, soon to be ex-spouse, has a drinking issue and has, while they're separated, continued to drink and drive.
Under the microscope. They're under the microscope and they still can't control it. Yeah. Mm-hmm. This is another area where if people will embrace help, go see a counselor, go to AA, go to groups. There's so much available out there. But if they're on the witness stand and they cannot answer, what are they doing about it? Who is their sponsor? What step are they on? Mm-hmm. These judges know to ask those questions. If we don't ask them, the judges might ask them. They want people to be in treatment and to be in recovery. They understand how it works. But the people who are just like, oh, no, it's fine. I just stopped. I'm not doing anything to deal with my recovery. We don't believe them.
Right.
Which is the good part to me about, so if someone's going through or about to go through a divorce, they come to you because you know the law, you know the process. They're coming to you going, most people have no idea, right? So they're looking at you going, guide us.
Correct.
But I think what most people don't do is before that, or even outside of divorce, outside of relationships, just go, oh, I have an issue. I have a problem. Let me go see a therapist to help me figure that out.
Yeah.
Because this person has years of training and years of experience. Even if I go for a couple of sessions just to get some information and then figure out what to do with that information, and now I am more equipped to handle the situation, because most people have no idea of the bounty of resources there are for substance abuse, mental health in this day and age. And they're not all high costs. There's plenty of free, there's plenty of religious, non-religious options. There's a million different options out there. So go talk to somebody that can actually help you walk through those options.
Yeah, you don't always have to go to rehab for 30 days and lose your job or whatever. It's not like that anymore. There's so many ways to craft something personal for the person who has the issue. And there's such a range of issues too, right? I mean, it's not just alcoholic, not alcoholic.
Right.
The relationship with alcohol can be explored in counseling and figure out what to do.
Well, I think people don't I think they still separate out. There's substance abuse or misuse, and then there are mental health issues. And I think it's been a rare case where I've not seen those two together.
Yes.
Right. Because
that's why they're drinking, maybe.
Why they're drinking, right? Yes. They're depressed or they're anxious. They are having sleep issues. Like they're using alcohol or some other substance as a way to try to cope and address that. And I think a lot of people in this age that you're talking about, the boomer age, maybe even some Gen Xers as well, don't really see alcohol as problematic. Right? It's always been part of their culture, part of their upbringing, and they think that they have control over it.
Yes. Look at TV. It cracks me up. Every TV show, the people pull hard alcohol out of their desk drawer and they're pouring it and drinking it at work.
Yes.
Like, who does that?
While they're pulling out a pack of cigarettes,
Right.
let it
Not be real.
That's the leftovers from the 1950s and 60s.
Yes. So that generation kind of grew up that way a little bit more.
Yeah.
When I first started practicing law 31 years ago, it was still acceptable to have alcohol at lunch.
Yeah.
Oh yeah, one of the universities I worked at had in their employee handbook a 2-drink minimum at lunchtime. It was still in there.
That's so crazy. Now I would be like firing a fence.
But the dangerous part is most people of any generation are not going to be honest about that because they know whether they think it's okay in their heads. They know this person sitting in front of them or their spouse or their son, daughter, whoever it might be, is not going to look so kindly on their... I mean, I've had plenty of individuals where I've had the spouse reach out to me or they've come in just to have some collateral information and they'll talk about, oh no, they drink 2 bottles a night. They drink 6 doubles a night, whatever it might be. And that's a very different picture than the client originally painted. And a lot of times it's because they don't, one, there's shame around it. And 2, they don't want to stop what they're doing.
No.
Even though it's killing.
Yes.
Yes. Well, as Dr. Fast said, it's become their coping mechanism.
Yeah.
And I've definitely had clients who I'm like, you need to get new tools. You don't have any. Yeah. That's why you're doing this. And you can acquire them.
And by the way, it's
help.
making your issues worse.
Yes.
It may be delaying them or distracting you from them, but it's almost guaranteeing that it's getting worse instead of healthy coping mechanisms that are not only going to help you cope, but may actually improve the problems or diminish the effects.
Yes.
A metaphor that I've used with couples where one partner is really struggling with their relationship with alcohol in particular or drugs is I talk about it as being the third entity in the marriage. It's like they may not have any outside romantic relationship, but that's the mistress.
That's good.
Because their attention, their relationship is on the substance, not on their spouse.
They're spending their life thinking about how to get the next drink, how to be in a situation where, how does that involve the alcohol?
Yeah. Or how do I get through this week so that I can get to the weekend and then I can binge,
Yeah.
Yes.
And the problem is once it gets to that level, it touches every aspect of their lives and of their relationship. So then they become the identified patient and they feel like the finger is always pointing at them, where I always point out, I would love to be able to get to your partner's issues, but we can't get to that if you're drinking yourself silly every day. And so that impedes any work. In fact, it's one of the things they call a contraindication that gets in the way of couples therapy is if there's an active addiction going on and a person's not willing to get help or admit that they have a problem.
Oh, yes.
The relationship is not going to get better if there's constant addiction.
We're talking about alcohol primarily, but the rise in the use of marijuana and other substances with this microdosing, I can't tell you how many individual clients and couples that I've been talking to where it started out as something that generally was just recreational, right? They would 1 or 2 times a week, they might have a joint together or do something like that together until it became the coping strategy. And now it's every evening after work, it's all day on a weekend. And so it's no longer a entertainment factor, it's a coping strategy. So young people, I think you're right. Like we're not seeing alcohol as much of a problem for the younger generations, but we're absolutely seeing marijuana and other things being kind of that third entity, that problem in the relationship.
Yeah. Now I'm hearing people talk about their dosing, I guess, what used to be LSD or whatever. And they say, oh, it helps reset your brain or whatever. And I'm like, well, I like my brain chemistry. I don't want to mess
But
with
it's a meditative experience, or it's an opportunity to grow or expand, or obviously it's not legal in Texas, but with marijuana being legalized in a lot of states and people using THC vapes and all kinds of other things, there's this idea, oh, because it's legal, it's not
right.
It's healthy or it's okay. And like, let's point to alcohol, right? It's legal to drink once you're 21 in Texas, but that doesn't mean it's healthy for you. It's good for you.
Right. I'm not a fan of the marijuana because I think it really causes people to have no motivation and they can't connect well, in my opinion. Yeah. And so how do you have a healthy relationship if you can't connect with another human being because you're stoned?
Right.
Well, I think it's like the rule, everything in moderation, right?
Yeah.
Like you're talking about, there are a lot of people that really struggle to do anything in moderation, but certainly marijuana, where there's this idea of like, well, it's harmless. But if it gets to the point where you can't live your life, how harmless is it?
Right.
You know, like, no, is it going to cause you to be more violent?
No.
Probably not. Is it going to cause you to wreck your car? It might.
It might, yeah.
Is it going to cause you to lose motivation?
Like driving your car.
Yeah. I mean, and we can go to the extreme. There are some people who, because of their chemistry, they can have a psychotic break from marijuana.
Oh my gosh.
And so it's, it's healthy because it's a natural substance, but it's not really.
Yeah.
Right. Especially with long-term frequent use.
Mm-hmm. Well,
it was very uplifting.
People. Please help all the people to be better. No, it's a struggle, right? Addiction is real, and we've touched on a couple of addictions, but there's spending and there's gambling and there's eating.
Pornography.
Oh my gosh, I know. Sex addiction. Yep. So unfortunately, the human condition is there's a lot of addiction out there.
But know that these are things that we see all the time. You should not feel ashamed if you or someone you know is dealing with those things. Come and talk to someone, even if it's to try to get someone else help, just to get more information.
Absolutely.
You're going to get no judgment in a therapist or
right.
Not a good one.
So how can somebody reach your group?
So you can go to our website, scctherapy.com, SCC on that one. You can also call us at 972-841-1731. Those are the two easiest ways, and then you can reach out. We'll get you all set up. And even if we have free consultation, so even if you want to talk to one of us and just chat with us for 15 minutes, we'll hop on a virtual call, just talk about what you're looking to get help with and whether we'll be a good fit, or whether therapy is the right fit for you, or if there are other resources that would be more advantageous.
And different counselors have a different focus, so you would be able to match them because you have such a big group.
Yes.
Yep.
Once you understood the issues, you'd be able to recommend, hey, here's 2 or 3 in our group that would be a good match.
Yep. There's a filter on our website, but oftentimes, honestly, the easiest way is to call, and one of our admin team, this is what they do every day, right? So they talk with you for a few minutes about what you're going through, and they can tell you based on what your need is, what your presenting problem is, and where you live, on who's going to be the best fit for you.
That's great. Thank you so much for being here.
Yeah, thank you for having us.
You're welcome.
Fun.
Thank you for watching. Please tune in again to the Melinda Eitzen Show.